Welcome to the Keeping It Simple series for pharmacology. KISS Pharm has become a very, very popular pharmacology resource for people in medical school, nursing school, dental school, podiatry school, pharmacy school, and it's because the method we use allows us to teach all of pharmacology in less than 10 hours. Actually, it's like less than 8 hours. And the way we do that is by teaching you concepts and patterns so you don't have to memorize stuff, so you understand stuff instead. So without me talking too much about it, I'm just going to show you, okay? But before we begin, I want to give you a little positive message, okay? I always tell people if you see a flat EKG, that means you're dead, right? So if there's no ups and downs in life, that means you're dead. So if medicine was easy, if nursing school was easy, if all these schools were easy, everybody would do it. It's not going to be easy. It's going to be challenging. You're going to have ups and downs in life. But if you have no ups and downs in life, it means you're dead. So stay positive. Keep calm and carry on. There's nothing you can't do if you put your mind to it. And we're always here to help you if we can. You can contact us through our website, whether you're a student or not. We're always here to help. Let's begin by doing a little exercise so I can introduce you to the KISS method, and then we will get into autonomic nervous system pharmacology, a little bit of antibiotics, and end with equation on cardiology. What is cancer? Well, cancer is rapidly dividing cells. Cancer is
rapidly dividing cells.
Cancer is rapidly dividing cells, but it's not just rapidly dividing cells, right? Because you have rapidly dividing cells in your body that divide and divide and divide and keep your hair growing, keep your skin from drying up, right? And you want that to happen. But cancer is out of control rapidly dividing cells, specifically in a cell line or cell that has a mistake, a mutation, an aberration, and it divides and divides and divides and divides, and you can't stop it. We call that cancer. So let's talk about where some of these rapidly dividing cells are located. You have them in lots of parts of your body. I'm only going to talk about 4 right now to prove a point. So I want you to repeat after me. Skin.
Skin.
Skin, hair.
Skin, hair.
Skin, hair, GI.
Skin, hair, GI.
Skin, hair, GI, bone marrow.
Skin, hair, GI, bone marrow.
Skin, hair, GI, bone marrow. Now, before we go any further, let's take a step back and talk about OB-GYN and talk about what vitamin we like to give to women who want to become pregnant or are pregnant. And that vitamin is?
Folate.
That vitamin is folate. And the reason we give them folate, according to your textbook, is to prevent neural tube defects. That's what you read, that's what you understood, and that's what you repeat when I ask you that question. Well, what I want you to know is that, yes, it is given to prevent neural tube defects, but the reason it's given to prevent neural tube defects is because folate is needed by all rapidly dividing cells. Folate is needed by
all rapidly dividing cells.
It's needed by all rapidly dividing cells, and when that woman is pregnant, those cells are dividing and dividing and dividing and dividing. That baby is growing and growing and growing. If that baby doesn't have folate, those cells can't divide, and you can have problems. The most serious and common is neural tube defects. So, rapidly dividing cells, I told you, need folate, and I told you cancer is rapidly dividing cells. Do you want your cancer cells to have folate?
No.
No, that's why if you look at your PDR and your pharm textbook, you will see that 9 out of 10 cancer drugs target the synthesis of folate. Okay? You can memorize or you can understand. I want you to understand, because when you understand, you won't make a mistake. So let's repeat where these rapidly dividing cells are located again. Skin.
Skin.
Skin, hair.
Skin, hair.
Skin, hair, GI.
Skin, hair, GI.
Skin, hair, GI, bone marrow.
Skin, hair, GI, bone marrow.
Because when you're trying to stop cancer, these rapidly dividing cells, you're going to get the effect you want, but the side effects you're going to get anyway. This is why all cancer patients have dry skin, why they have hair loss, why they have GI upset, nausea, vomiting, cachexia, loss of weight, loss of appetite, why they're fed small, frequent meals. This is why they have bone marrow suppression or myelosuppression, why they have anemia, leukopenia, maybe even neutropenia. Okay? It's all because these rapidly dividing cells need folate, and when you're targeting cancer, you're targeting rapidly dividing cells. You're going to get the effect you want and the side effect you want anyway. So you can sit there and you can memorize every side effect to every drug, or you can understand the physiology and the mechanism of what you are trying to accomplish, and the KISS method is about understanding and not always memorizing. That being said, every time I go to schools, and I go to lots of schools, I'm happy to come to yours if you want me, I ask them, hey, what are the hardest parts of pharmacology for you? And they, without blinking, say autonomic nervous system pharmacology, antibiotics, and cardiac. So let's talk about ANS Pharm first. The autonomic nervous system is divided into 2 parts. the parasympathetic nervous system and the sympathetic nervous system. The parasympathetic part of the autonomic nervous system is also known as the cholinergic system. Another word for parasympathetic is cholinergic. Another word for parasympathetic is?
Cholinergic.
Another word for parasympathetic is?
Cholinergic.
Excellent. Another word for parasympathetic is cholinergic. And in this parasympathetic cholinergic system, you have receptors, and drugs work on receptors, and most of the receptors in the parasympathetic cholinergic system are muscarinic receptors. Most of the receptors in the parasympathetic cholinergic system are muscarinic receptors. Most of the receptors in the parasympathetic cholinergic system are?
Muscarinic.
They're muscarinic receptors. And the first letter of muscarinic is?
M.
So these are M receptors. Your M1, your M2, your M3, your muscarinic type 1, your muscarinic type 2, your muscarinic type 3. You also have nicotinic receptors in the parasympathetic cholinergic system, but those nicotinic receptors are located in two generalized areas. How many areas?
2.
And that is your neuromuscular junction, abbreviated NMJ, and autonomic ganglia. We talk about that in more detail in the full KISS Pharm lecture, which is available at kisspharm.com. Now, why do they call the parasympathetic system the cholinergic system? Because remember, the sympathetic and parasympathetic system both use acetylcholine. They call the parasympathetic system the cholinergic system because the parasympathetic system uses acetylcholine presynaptically and postsynaptically. The sympathetic system just uses it presynaptically. We talk about that more in detail, like I said, on the actual KISS Pharm full lecture. This is just a sample, so I do want to mention it, but we're not going to focus on it. So we said another word for parasympathetic was cholinergic, and then we said most of the receptors are muscarinic. And let's talk about those receptors, but before we do that, let's go over something. What's the most important part of your body?
Brain.
The second most important part of your body?
Heart.
Third most important part of your body?
Kidneys.
Kidneys. We got brain, heart, and kidneys, right? Most important part of your body is your brain. Second most important part of your body is your heart. Third is your kidneys. So what happens? It's like that rap song. Started from the bottom, now I'm here. When you get sick, your body says, I got to save my brain, I got to save my heart, I got to save my kidneys. But if I get sick and I got to start making sacrifices, kidney goes first. That's why so many people have to see a nephrologist if they have a chronic condition. That's why so many people in the world are on ACE inhibitors. When the kidneys go, you can still survive. When the heart goes, which is next, you die. Okay? Without getting into too much detail here, it's a sample lecture. I did that all to prove one point. Most important part of your body is?
Brain.
Second most important part of your body is?
Heart.
Third most important part of your body is?
Kidney.
So where do you think your M1 receptor is located?
Brain.
And M stands for?
Muscarinic.
Is that parasympathetic or sympathetic?
Parasympathetic.
Cholinergic or anti-cholinergic?
Cholinergic.
Excellent, cholinergic. Where do you think your M2 receptor is located?
Heart.
Heart. Excellent. So muscarinic type 2 receptor is in your heart. Where do you think your muscarinic type 3 receptor is located?
Kidneys.
2 out of 3 ain't bad. M1 is in your brain. M2 is in your heart. M3 is everywhere else. Where's M3?
Everywhere else.
M1 is in the?
Brain.
M2 is in the?
Heart.
And M3 is in the?
Everywhere else.
Is in the everywhere else. Good job. You didn't fall for the trap. So here we go. I'm going to ask you 4 questions. The answer every single time is going to be M3. Got it? Excellent. Which receptor can I stimulate to cause an increase in exocrine gland secretions?
M3.
Excellent. If I increase secretions, am I going to be wet or dry?
Wet.
Wet. Excellent. So far, M3 is making you wet. One thing. Which receptor can I stimulate to cause an increase in gut motility?
M3.
And if I increase gut motility, are you pooping more or less?
More.
More. So do you want to give a cholinergic to somebody who has constipation or somebody who has diarrhea? Constipation. Excellent. So far, you're wet and you're pooping, right? It's all due to this receptor M3, and M stands for muscarinic, and muscarinic, remember, is parasympathetic, and parasympathetic, we said, is cholinergic. Which receptor can I stimulate to cause bronchoconstriction?
M3.
And if I cause bronchoconstriction, is it going to be harder or easier for you to breathe?
Harder.
Harder for you to breathe. So do you want to give a cholinergic or an anti-cholinergic to somebody who has asthma?
Anti-cholinergic.
Excellent. Well done. So far, you're wet, you're pooping, you can't breathe, and it's about to get worse. Which receptor can I stimulate to cause bladder contraction?
M3.
And if I cause bladder contraction, are you going to be peeing more or less?
More.
More. So check it out. Repeat after me. M3
M3.
makes me pee.
makes me pee.
M3 makes you pee. It even rhymes, so check it out. M3 is making you wet. It's making you pee and poop. Things are coming out of both ends, and you can't breathe. It's all due to one receptor, and that receptor is?
M3.
And M stands for?
Muscarinic.
Is that parasympathetic or sympathetic?
Parasympathetic.
Cholinergic or anti-cholinergic?
Cholinergic.
And now you've seen the word cholinergic multiple times, and every time you saw cholinergic, 4 letters have been nice and big. What 4 letters do you see nice and big in cholinergic?
CHOL.
CHOL. There's a drug we use for post-op urinary retention. There's a drug we use for post-op urinary retention. That's just a big fancy way of saying your patient can't pee and you want to make him pee. And what receptor makes you pee?
M3.
And M stands for?
Muscarinic.
Is that parasympathetic or sympathetic?
Parasympathetic.
Cholinergic or anti-cholinergic?
Cholinergic.
Take a guess. What 4 letters do you think are in that drug?
CHOL.
The name of the drug we use for post-op neurogenic ileus and urinary retention is bethanechol. And just in case those 4 letters don't give it away, don't help you remember it, there's a nice little picture for you. Okay? Bethanechol, CHOL. Bethanechol is a drug. I want you to start looking at it this way. That's why I have made it in green and big and bold and capitalized. There is a pattern. I want you to know these patterns. It will make your life easier. Bethanechol is used for post-op and neurogenic ileus and urinary retention. There's another drug. This drug is used in the asthma challenge test or the airway challenge test. What does that mean? That means you suspect a patient has asthma, but you can't just start treating them. You have to confirm your diagnosis first. You have to confirm your suspicion. So what you do is you say, okay, Mr. or Miss Patient, I'm going to give you this drug that's going to cause bronchoconstriction by acting on which receptor?
M3.
M3, and it's going to make it harder for you to breathe just for a little while. But don't worry, I'm here, I'll take care of you. It's not going to last that long, but I just want to see if you have asthma or not. So I'm going to conduct this asthma challenge or airway challenge test. It goes to M3 to cause bronchoconstriction, and M stands for?
Muscarinic.
Is that parasympathetic or sympathetic?
Parasympathetic.
Cholinergic, anti-cholinergic?
Cholinergic.
What 4 letters are going to be in that drug?
CHOL.
The name of the drug we use in the asthma challenge or the airway challenge test is methacholine. And you see a black lung there because it makes it harder for you to breathe. You will see a green one when it makes it easier for you to breathe. So the drug there is methacholine. It goes to M3 and induces bronchospasm, which is why we use it in the asthma challenge or airway challenge test. So we talked about 2 drugs, bethanechol, methacholine, and you guys are used to seeing drugs like this, and I want you to instead start looking at drugs like this. There's a pattern. I want you to know that pattern. So we talked about cholinergics. We said cholinergics stimulate or agonize muscarinic receptors, but now we're talking about anti-cholinergics. So instead of stimulating or agonizing these receptors, we are going to block or antagonize these receptors. And before I continue, I want you to know something. Cholinergics agonize or stimulate muscarinic receptors, which is why they are sometimes referred to as muscarinic agonists. Anti-cholinergics antagonize or block these receptors, which is why sometimes they're called anti-muscarinics. Okay? I'm going to ask you a series of 4 questions, and the answer every single time is going to be M3. Which receptor can I antagonize to cause a decrease in exocrine gland secretions?
M3.
And if I cause a decrease in secretions, am I going to be wet or dry?
Dry.
Dry. This is why anti-cholinergics make you hot and dry. Which receptor can I antagonize to cause a decrease in gut motility?
M3.
And if I decrease gut motility, am I going to be pooping more or less?
Less.
Less. So do I want to give an anti-cholinergic to somebody who has constipation or somebody who has diarrhea?
Diarrhea.
Excellent. So far you're dry and you're not pooping as much, right? And look here, everything is decreasing and is blocking, so it's red, okay? So we try to use colors to help you visualize things. Which receptor can I block or antagonize to cause bronchodilation?
M3.
And if I cause bronchodilation, will it be harder or easier for you to breathe?
Easier.
Easier for you to breathe. So which drug do you want to give, a cholinergic or an anti-cholinergic to treat a patient that has asthma?
Anti-cholinergic.
Anti-cholinergic to treat asthma. Which receptor can I antagonize to cause bladder relaxation?
M3.
And if I cause bladder relaxation, are you peeing or not peeing?
Not peeing.
Not peeing. That's why this is the drug you give to R. Kelly when you see him. Remember the Chappelle show? Trip, 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 pee, pee, pee. he's talking about. R. Kelly's got incontinence. Relax his bladder. He won't pee so much. All right? And all that is, once again, the M3 receptor, but now instead of agonizing, we're antagonizing. Instead of stimulating, we're blocking. That's why we call these anti-cholinergics. When you want to be anti-cold, you go to the tropics. When you want to be anti-cold, you go to the tropics. When you want to be anti-cold or anti-cholinergic, you go to the tropics. Let's spell tropics. Go.
T-R-O-P.
Stop. Do it again.
T-R-O-P.
And one more time.
T-R-O-P.
When you want to be anti-cold or anti-cholinergic, you go to the tropics. Atropine, homotropine, tropicamide. You see those 4 letters, T-R-O-P, are in all of these anticholinergics. Okay? And you'll talk about atropine a lot when you start talking about organophosphate poisoning and anticholinesterase poisoning. We will do that in the full KISS Pharm lecture, which is at kisspharm.com. Repeat after me. Park your Benz.
Park your Benz.
Say park your Benz.
Park your Benz.
For Parkinson's, we use a drug called benztropine. That's why I said park your Benz. Parkinson's, benztropine. And what 4 letters are in the middle of benztropine?
T-R-O-P.
When you want to be anti-cold or anti-cholinergic, you go to the tropics. What receptor does this drug work on?
M3.
M1 is in the brain, M2 is in the heart, M3 is everywhere else. This is a condition affecting the brain, so the answer is M1. What receptor does this drug work on?
M1.
So if you sign up for the KISS Pharm series, you will get the lectures, and at the end you will get a quiz, so you can see that you are, in fact, grasping the information that you need to be grasping. It's a fat-soluble, lipid-soluble drug that's used for Parkinson's. It's also used for extrapyramidal symptoms due to antipsychotics, so I'll give you a little connection here. Antipsychotics usually target and use dopamine, okay? They work on dopamine, and anytime you involve dopamine, you're going to affect movement because dopamine is involved in your movement pathway in your basal ganglia in both the indirect and direct pathway. Now, that might be a little too much detail for you at this point, but the take-home message is antipsychotics, use dopamine. You mess with dopamine, you mess with movement. That's why they have extrapyramidal symptoms, and you can use benztropine for that. Repeat after me. Say, I pray, I breathe.
I pray, I breathe.
I pray, I breathe. If a patient has asthma or COPD, they say, I pray, I breathe. And you say, hey, I pray, you breathe too. Let me give you some I pray or ipratropium. The drug is I pray or ipratropium. And what 4 letters do you see in the middle of that drug?
T-R-O-P.
Excellent. I pray or ipratropium, safe to use in asthma and COPD. Let me show you how it works. Let me show you how easy it can be if you can figure out how all these drugs were named and you can put them in the right categories. Let me show you how much information you can get just by having a clue of these 4 letters. I'm convinced there's like some little Indian guy sitting in a lab going, they don't know what I am doing. He's naming all these drugs and you're sitting here trying to memorize it, okay? I'm going to give you a little pattern. So you have to do this and pull your hair out. Okay? I used to have a full head of hair until I started teaching pharm. Tiotropium bromide. What 4 letters do you see nice and big there?
T-R-O-P.
Excellent. So what kind of drug is it?
Anti-cholinergic.
If you want to be anti-cold or anti-cholinergic, you go to the tropics. Okay? So we know it's an anti-cholinergic. So what is this drug's mechanism of action? What receptor do you think this drug is going to?
M3.
And do you think it's blocking M3 or stimulating M3?
Blocking.
Right, because it's an anti-cholinergic, so it blocks your M3 receptor. Now, I told you M3 does 4 things, right? So now when I ask you, what is this drug used for, you take one of those 4 things and you turn it into a condition, right? Now, what is this drug used for? This drug is used for asthma. This drug is used for asthma, right? So you just take bronchodilation and say, okay, I would want bronchodilation in somebody who has asthma or COPD. Boom, there's one. And on your test, you usually won't have more than one of those choices from that receptor, so that's how you keep it straight. So tiotropium bromide, the brand name is Spiriva, okay, and it's used for asthma and COPD, okay? So once you know and you start to recognize these patterns, you can figure out a lot of things about these drugs without having to memorize every single one of them, okay? All right, let's talk about some antibiotics. Let's talk about tetracyclines. Now, I'm going to tell you some stuff about this drug to show you 2 things. One, how when there's not a pattern, we can memorize things easier by coming up with a pattern. And 2, by showing you how they can put 2 words in a textbook and turn it into 5 or more questions. So let's get started with tetracyclines. Tetracyclines, the first letter is a T, and the T right there, does it look like a positive sign or a negative sign?
Positive.
Well, that's how I remember that tetracyclines. treat gram-positive infections. Okay? Now, one thing that they love to ask about tetracyclines is, why did this patient take a tetracycline and it didn't work? Why was this patient resistant to tetracycline? So let me tell you, okay? You go to a nightclub. Who's outside the nightclub?
Bouncer.
Got a bouncer outside the nightclub, and the bouncer's got two jobs. He does one of two things. He prevents you from coming in, or he kicks you out. Got it? Bouncer's got two jobs. Prevents you from coming in, or he kicks you out. Understand? He works at a club, and the name of this club, well, it's not a very popular club. People don't like to go there, but it's got a horrible name, okay? The name of this club is Cell. What's the name of this club?
Cell.
And this bouncer, he's got no friends because his mother named him Transport Pump. What's the bouncer's name?
Transport Pump.
So they've got this bouncer named Transport Pump standing outside the club called Cell, and he's got two jobs: prevent you from coming into the cell or kick you out of the cell. Okay? And that's how you become resistant to tetracyclines. Decreased uptake into the cell. Bouncer's saying you can't come into the club. Or increased efflux out of the cell. Bouncer's saying you got to get out of the club. Okay? And it's all done by plasmid-encoded transport pumps. I love to ask about that because students don't tend to remember it. But you will now. Tetracyclines, side effects: GI distress, discoloration of teeth, inhibition of bone growth in children, photosensitivity, contraindicated in pregnancy. That's a lot of stuff to memorize. Side effects: GI distress, discoloration of teeth, inhibition of bone growth in children, photosensitivity, contraindicated in pregnancy. You can memorize it. You can memorize it the way they gave it to you, or you can memorize it my way. My way. First letter of tetracycline is?
T.
So let's go with all the T's. T, it works on a 30S subunit. T for tummy, for GI distress and GI upset. T, you can't get taller, inhibition of bone growth in children. T, transport pump, that's the bouncer standing outside that club. And T for teratogen, contraindicated in pregnancy. Okay? Another T, T for teeth, discoloration of teeth. So now we got all the T's with tetracyclines. Now let's talk about some of these drugs. There's only one tetracycline that's hepatically excreted. Only one tetracycline that's hepatically excreted. Got it? And when something is hepatically excreted, is it coming out of your front end or your back end?
Back
Your back end is going in your doo-doo. Where's it going?
Doo-doo.
Doo-doo. So spell doo-doo.
D-O.
First two letters of doo-doo are D-O, like doxycycline or doo-doo-cycline, which is the only tetracycline that's hepatically excreted. Doxycycline or doo-doo-cycline. Now, check it out. You got two words in the textbook. This is how they make it 5 questions. What's the only tetracycline safe to give to a patient who presents to your office and has elevated BUN and creatinine levels? And you will say?
Doxycycline.
What's the only tetracycline safe to give to a patient with a gram-positive infection that has acute renal failure? And you will say?
Doxycycline.
What's the only tetracycline safe to give to a patient with a gram-positive infection that presents to your office with hematuria? And you will say?
Doxycycline.
What's the only tetracycline safe to give to a patient with a gram-positive infection that's on dialysis? And you will say?
Doxycycline.
Because it's hepatically excreted, it is not going to your kidney, so it is safe to give to people who have kidney-related issues. And everything I mentioned was a kidney-related pathology, right? Because a lot of these other tetracyclines are nephrotoxic. This one is not. Everybody follow. That's how they take these two words and ask you a question about it. Everybody read it, but did you understand it? And here at KISS, we want you to understand. There's another drug, and this tetracycline is high yield because they like to ask this tetracycline not in relation to gram-positive organisms, but in relation to something completely unrelated, which is SI-ADH. And you don't expect an antibiotic to be on that list, so people pick the wrong answer. But you won't, because you watched the KISS Farm video. There's a tetracycline we use, and it can be used as a diuretic in SI-ADH. And SI-ADH stands for Syndrome of Inappropriate Anti-Diuretic Hormone Secretion. That means you have too much ADH. Now, I always ask people when I go to schools, hey, what makes you pee more in SI-ADH? And they go, oh, ADH. And I'm like, no. ADH stands for anti-diuretic hormone, anti-diuresis, which means you are not going to have diuresis, which means you are not going to pee, right? So SI-ADH is syndrome of inappropriate anti-diuretic hormone secretion. So what makes you pee more in SI-ADH? You can actually get to a point of natural diuresis in SI-ADH, and that's because of this. So pay attention. If you have too much ADH, are you peeing or not peeing?
Not peeing.
So you're having too much volume. So volume in your body, if you are not peeing, is going up or down?
Up.
So stroke volume is also going Which means stretch in your right atrium is going and your right atrium is releasing ANP or atrial natriuretic peptide, which is causing you to have physiological diuresis and expel that urine and get rid of some of that volume. If you don't get to that point and your patient needs some assistance having diuresis and starting to expel some of this volume, you can give them an ADH antagonist, and that ADH antagonist is a tetracycline. That tetracycline is demeclocycline. Say it.
Demeclocycline.
Demeclocycline can be used as a diuretic and SIADH, and be very cognizant of that drug, know it, and don't be tripped up when they ask you that drug and they do not ask it to you in relation to an organism, but SIADH. There's another one. I like to have fun with this drug, okay? This is a tetracycline that we can use because it's effective against acne. And remember from a previous lecture that we can use vitamin A for acne also, because vitamin A helps maturation of epithelial cells. Okay, we'll talk about that later, just mentioning it now. But there is a tetracycline we can use, and it's effective against acne, and the name of that drug is minocycline. Say it.
Minocycline.
And the way I remember it, I just say, me, no, like acne on my women. Me, no, like acne on my women. Minocycline is effective against acne as well as rosacea. Now we talked about parasympathetic drugs. We talked about cholinergics, anti-cholinergics. We did some antibiotics, and now I want to go back in to the sympathetic part of the ANS and mention some receptors and a quick equation for you to show you how KISS really works. Now, every time I go to a school, and I said I go to lots of schools, I ask everybody, hey, what receptors cause vasoconstriction? What receptors cause vasodilation? And I never get the right answer. They'll get half of it right, but not all of it. But you're going to get them all right, because I'm going to teach you a trick. You got a one-lane road and you got a two-lane road. You got a one-lane road and you got a two-lane road. What road has more room, the one-lane road or the two-lane road?
Two-lane road.
The two-lane road has more room. So what has less room, the one-lane road or the two-lane road?
One-lane road.
So you're telling me the one-lane road has less room and the two-lane road has more room. Is that correct?
Yes.
So now we got to name this road. We got to name this one-lane road that has less room. This one-lane road that has less room needs a name. This one-lane road that you told me has less room needs a name, and you can pick from one of two names. You can pick from vasoconstriction or vasodilation. You got to name this one-lane road one of these two names: vasoconstriction, vasodilation. Pick one.
Vasoconstriction.
Vasoconstriction. That's how I remember. Alpha 1, beta 1, one-lane road. Less room, cause vasoconstriction and raise your blood pressure. Alpha 2, beta 2, two-lane road, more room, cause vasodilation and decrease your blood pressure. You'll never forget that. If you ever forget, just think about roads. All right? Now, let's talk about an equation. Okay? This equation, CO equals SV times HR. This is what? Cardiac output equals stroke volume times heart rate. Now, I'm mentioning it now, and I'm going to talk about it again in a second, but this equation is telling you what? If stroke volume goes down, heart rate must go up. If heart rate goes down, stroke volume must go up to keep cardiac output constant, right? One goes down, the other one must go up. So, before we talk about this equation, let me give you a little clinical applications, then we'll get to it. African Americans and Hispanics, okay? African Americans and Hispanics have a high sodium diet. And what follows sodium everywhere it goes?
Water.
So is that patient going to have too much or too little volume?
Too much.
Too much volume. How do you get rid of volume?
Diuretics.
Diuretics. That's why we give African Americans and Hispanics diuretics for hypertension. Middle-aged white men have hypertension due to stress. And what does stress do to heart rate?
Increase.
And the drugs we use, okay, to decrease heart rate are beta blockers. What do we use to decrease heart rate?
Beta blockers.
We use beta blockers to decrease heart rate because normally beta receptors increase heart rate. So if we block them, we can prevent that increase and cause a decrease. So that's why we give middle-aged white men with hypertension beta blockers. The elderly who have hypertension usually have hypertension due to a buildup of plaque or atherosclerosis, and plaque is made up of what element from the periodic table?
Calcium.
Calcium. That's why we give elderly people calcium channel blockers for hypertension. Okay? So when you start thinking about why, you don't have to start memorizing as much, and things start to make sense and come together. So let's get back to this equation. I told you that beta receptors normally increase heart rate, but if you block the beta receptors, you can't increase heart rate. Does that make sense? So cardiac output equals stroke volume times heart rate. So here we go. We got a guy in Texas, loves to work out, stay in shape. He's running in the Texas heat, and he's sweating, but he does not drink enough water. So as he's working out and sweating, what's happening to the volume in his body? It's going
Down.
excellent, which means stroke volume is also going.
Down.
And how is his body going to try to compensate? You have to increase what?
Heart
If
rate.
he's on a beta blocker, can he increase heart rate?
No.
No. So what happens is the body says, okay, I've got little volume left. I better save what I have, so I better cause vasoconstriction and tighten these vessels to save what little volume I have, so vessels constrict, and they constrict, and they constrict, and they constrict, and eventually that blood pressure goes up so high that patient passes out. That is actually what heat stroke is. That's a clinical example of this equation and how that equation can come to life when you put a story behind it, when you understand it as opposed to just memorizing it. Okay? So what are you, as a good medical practitioner, going to tell all of your patients on beta blockers to do?
Hydrate.
Hydrate, drink water. One time I asked somebody, I said, tell them not to work out. Don't do that. Just tell them to drink water. All right? That brings us to the end of the sample lecture. Keep in mind that KISS Prep, okay, includes KISS Pharm, KISS Anatomy, KISS Biostats, and KISS NCLEX. We are getting ready to launch a series for the pediatric shelf, internal medicine shelf exam, biochemistry, pathology, as well as a neuroscience series in conjunction with first aid for organ systems, as well as an EMS series in conjunction with Limmer Creative. So all of these new series, as well as the current ones, can all be found at kissprep.com, which will contain even more sample lectures for all of those subjects. We do campus visits. We do group pricing for classes and institutions for institutional sales. Please like us on Facebook and YouTube. You can find us by searching KISS Prep. Appreciate you guys watching the video. Please be sure to check out our websites, and I hope you guys learned something.